When we look at how youth are engaged in NTDs, it's mostly as beneficiaries of either programs, projects, or policies that we have adapted. And when we are talking about nothing for youth without youth, then it is important for us to shift this narrative into positioning youth not just as recipients of our interventions, but partners in creating sustainable solutions and create spaces where diverse youth voices are able to participate, but also people with lived experiences are able to contribute in creating these solutions that help in the fight against neglected tropical diseases.
The biggest barrier for youth is not a lack of ideas or motivation, but a lack of resources and access. At national and local levels, youth initiatives are often closest to communities and understand the realities on the ground, which make them well positioned to contribute to tackling NTDs. However, many youth-led efforts struggle with limited funding, mentorship, and opportunities to scale their work. And this is where international platforms and leading organizations can play an important role by creating spaces for collaboration, knowledge sharing, and capacity building.
From youth initiatives and NTDs, we've learned that when young people organize, they become powerful bridge builders across disciplines, regions, and communities. So if we want stronger global health collaboration, include young people into program design and decision making, support youth networks with sustainable funding, and make sure the voices of young professionals are central in shaping strategies, not only in implementing them. Because the future of global health will only be sustainable if we create it together across generations.
When we talk about youth engagement in NTDs, the most meaningful contribution is not just inclusion, but connectivity. Across many countries, many NTD youth initiatives are deeply embedded within communities. They understand the local realities, the social dynamics, and they turn those realities into advocacy and action, extending the work of NGOs and programs. But we have both opportunities and challenges. The opportunity is that these NTD youth initiatives can meaningfully augment existing NTD efforts and work. But the challenge is ensuring that these initiatives are meaningfully supported. They're not just symbolically included, but they're included as equal partners, given the right mentorship, resources, and a space to sustain their work and ideas.
Our journey at NTD's Youth Japan began with this youth network, a simple connection across borders that has grown into real solidarity. In a time when the world feels divided, we choose to unite. And when youth unite, we don't wait, we act. Through every action we take together, we move closer to the future where we can finally eliminate NTDs.
Across the globe, very many young people are already leading prevention efforts when it comes to NTDs advocacy and even mobilizing other young people into the space. However, the real collaboration happens when youth in the global north and those in the global south come together. Through this, we are able to exchange ideas, challenge long-standing imbalances, and even work together to design public health programs that reflect the realities of our communities. That is to mean, if we are to realize equity and sustainability in public health programs, then we have to trust the young people to lead.
We aim to tackle NTDs not just medically, but with the creative solutions, locally driven, culturally resonating, research supported, incorporating social media with digital platforms. Through global collaborations with other NTD youth associations, we are the local hands for the global vision. NTD advocacy and treatment is a gift for the next generation. The youth. The youth should not just wait for a solution. The youth is the solution.
Our story began with a simple disruptive idea that young people are not just beneficiaries of health programs. They are the experts of their own communities because they own the community. Today, Food Impact Globals has integrated over 1,000 plus leaders into the art of NTD advocacy. We didn't wait for permission to lead. We built campus clubs where awareness became impact. We launched peer-to-peer engagement programs where teenagers talk to teenagers, breaking the silence on stigma that even the most well-funded government programs sometimes miss. by working hand in hand with government agency and civil society, we have proven that youth aren't just a target demographic. We are the bridge between policy and the people.